Guys, welcome back. I don't know why they are making such a post over there because at this point is very crucial and they are saying that don't take DNB and all. I have no idea why they are doing it because getting a PG is really important because everybody is not living in the same condition. So, first of all, I will read that post. Considering the factors before opting for DNB. Theoretically, DNB is equivalent to MDMS but not practically. Unfortunately, still private hospitals are biased against DNB. MDMS preferred during the interview for government job as SR and AP. Low passing rate. The most troublesome issue. Better to check the passing rate of the residents in the department you are thinking of joining. That's true. Both are true. One is about the government job, second is about the pass percentage. Consider third one, that is a low salary, leaves lesser leaves, slightly less harassment toxicity, workload could be low at some place, but you would still waste most of the time in the hospital during the merge work. Less exposure, especially in surgical branch, you will not get free handouts easily. You will have to ask consultants for every small thing. Yes, indeed, it's true because in government you will get plenty of patients, and it's your responsibility to do that because there is that much of load is there compared to the DNB and diploma seats. That's true. Indeed, it's a fact. It's not that patient in the private hospitals are different. There may not be huge crowd like government hospitals, but they would still keep you for small things and even complaint consultants if you did not pay attention to their whims and fancies. And not much of academic activities in the private hospital. Not that in help in any way, just to mention it. That's both the same thing, like academical activities including the the intercollegiate activities, camps and the workshops and the CMEs. These all things will be missed in the DNBs and diplomas. That's true, but it's not that really matters in the world. And the DMB candidate have to slog for a few years as associate and attending consultants before they gain any independence. I feel private hospitals want them. You will see DNB postgraduate and super specialist in department for many years, while MD DM shall keep coming and going. Obviously, there is a difference in promotions and salaries. Indeed, that's true. In the clinical practice for the patient, it doesn't matter whether you are MD or DNB and from where you have done your post graduation. It may matter initially, especially if you are from the premier institute like AIMS, but that's just the initial advantage. Most of the big shot private hospitals not taking people from the AIMS. If you are planning for a job in the government hospital as assistant professor, having MDMS help. Also, DNB may not give you a teaching experience you need, and hence you may be disadvantaged here. Some DNB institutions have the poor academics, and department professors may keep switching from one hospital to the another, leaving at times of DNB candidates alone in the department and the department non-functional for some time. That's again a true fact. They're telling the facts. That's true. So this is the one side of it. Everybody knows it, right? DNB having these kind of issues. That's true. And the 11th one, learning in the post graduation is directly proportional to the number of patients in the emergency OPD ward only up to a point, after which an quantity increases, the quality reduces. Most government hospitals have too much quantity of patients, due to which there is too much workload and that hampers the quality training. Most private DNB institutions have less quantity than desired. Few established renowned corporate hospitals have the good balance between the patient and the quantity and quality of care. They can be even preferred over MD in new medical colleges in the tier 3 cities. That's true. And there is no bond in DNB. That's true. There is no bond. If you're getting a good DNB program in tier 1 city, you can choose it over MD. I don't know why. If you get an MD, go for MD. There is no it's not wise to take DNB if you are getting a MD. And 2 to 3 years born in tier 1 or 3 cities, especially if you are planning for super specialties courses. Choosing DNB surgical stream is tricky. I'm not agreeing in that part because if you're taking DNB in a very good colleges, it's really good. I mean the hospitals. You won't get enough good hands-on training at many places. I don't agree with that part also. If you're going to take peripheral government hospital for MDMS, you won't get that much, hands-on training too. Emergency cases are very less compared to government hospitals. Also, you may need to do a SRship in government institution later on, gain hands-on training and operating independently. Always do through research before choosing surgical specialty in the DNB institutions. Somehow it's true. Last but most important, MD degree does help you to pass easily, get a job initially, especially if you are from a good institutions and an early promotions, and may also attract patients better than DNB. It will an extend initially, but this is just the beginning of your career. Once you are in the field for 3 to 4 years, all that matters is whether you have a good number of patients following up in your clinic, and that is completely independent of the fact whether you did DNB or MD. That word is the most important. It doesn't matter you did MD or DNB, it's all matter how you work after your degree and how many patients are following up your clinic and how good you are in your workplace. This is all matters. The bone teacher, my favorite teacher in Dr. Abbas Ali sir, he's most famous. I mean, I can tell you that one of the best orthopedic surgeon in this country, best teacher in this country, and he did DNB instead of MDMS, and he used to tell it in almost every classes. He used to tell that if you want a seat and you able to get a seat in DNB somewhere, go and take it if that's your passion, because it's all matters how you work after your degree. It's all matter about the skill and your passion into it. So just go for that. That's what he used to tell to the students. So I'm also telling the same thing. When I see this and I see the comment section, it's all against the DNB. I don't understand why the people are so hate the DNB or the diploma part. See, they do have a good rank, but not good enough to get into MDMS, or they don't have reservation, or they don't have that much money. So their situation is different from others, situation. So they have to take something. So at this point, because the counseling is going to happen at any time, I think this is the very the last minute for the counseling part, in which if you are put this kind of post, this is not good for the students, because they're going to be confused between what to do and what to not to do and all. So if you ask me, just follow your passion, go for it. Even if you're getting a DMR, a diploma in radiology, that's good, go for it. It really worth. If you see, the only diploma part which I am 100% I am telling you, that if you are getting a DMRD, go and do it. I can, you will get the money. And most importantly, when you're taking a PG seat, don't depend that on the money or something. Solely should be on the your passion. If you have that much passion towards one subject, you should go for it. So that's really matters in life. Otherwise, you have to be in the struggle, you have to be in the wrong place. There's so much of issues are there. So consider everything and choose the branch wisely. That's it. Don't listen to anyone.